coming along this morning. So, today I'm going to talk about a very important topic, and it's a topic that a lot of parents do get worried about as they begin feeding their child solids at around the 4 to 6 month mark. As well as being an advanced life support paramedic for around 11 years now, I do have 2 young children myself. I have a 6 and a 3-year-old, and unfortunately for me, I have dealt with a child that has a completely blocked off airway in my own home with my youngest daughter, and she's actually done it to me twice now. So she is my difficult child, or I always label her. She's the one always getting into mischief and hitting her head and getting injured in different ways. So today I'm going to cover that topic because as a parent or a caregiver of young children, if a child does begin to choke, you are the best person to help them, okay? There's no good in that situation you getting really, really anxious and not being able to help your child, because unfortunately time is quite critical. So obviously we know that air is vital for life, and the longer that we go without air, obviously the more damage that can be done to our bodies. So the good news, and what I hope to achieve today, is not to scare you that all your children are going to choke tomorrow, okay, because that's not going to happen. But if it does happen, you will, yes, be very anxious and worried and scared, but you will know what to do quickly, and it will be hopefully all over and done with in around 10 seconds, okay? So from an ambulance point of view, we do get calls for choking children reasonably frequently, but the great news for me is that when we arrive, we're usually met by a very happy toddler or young baby who's giggling away and laughing, and 2 very worried, crying, anxious parents who have just been through that ordeal. So the good news is that as a parent, you do usually do a great job. So today I'm just going to hone in on what skills to really focus on when your child is choking. Now, obviously, with all first aid injuries that we cover in our courses and illnesses and injuries, when we focus on the injuries, with children, the best thing to do is avoid them. And how do we avoid a choking episode? Well, you want to limit their access to those high-risk foods, those whole foods that are hard and firm that can easily lodge in their airway. So today, one of the other stands here, the ACCC product safety stand, they've actually given me their choking check guide that you can make your own choking check to see that's how much. If a product can fit through that hole, then yes, it could block off your child's airway. So it's just a reminder about the types of foods you want to avoid with your children. So if you want to grab one of those at the end of the session, I'll have those here for you. So things that I avoided with my children when they were quite young were the hard fruit and vegetables. So grating down the carrots and the apples, with the grapes and the strawberries, cutting those down into smaller sizes. Just the other week, one of my trainers from one of our courses in Sydney, she works at a paediatric emergency department, and she rang me and said that unfortunately she had a little toddler, 2-year-old, brought in who was in the care of her grandparents, and they'd come across this child. They weren't in the room when she obviously choked on the food. They'd found her a little bit of time later, and she actually passed away that day from choking on a grape. Okay, so just a reminder, grapes are perfect sizes to fit into that hole and block off their airway. So just chop them down smaller. Sausages, we always chop them down for the kids, but usually we chop them into a size that's perfect to block into their airway. So just remember about chopping them down further, okay? Whole nuts aren't great. Go into that airway. Popcorn is really easy for them to inhale. Marshmallows, chewable lollies and things like that are all things that I tend to say to parents, probably don't give them early on in their life. Wait for they've got some better action with their chewing down the track. So just be mindful about that. When it comes to choking in young children, between the ages of 0 and 4, we look at the types of things they choke on is predominantly food. So it's not so much the Lego and the things on the ground, it's the food. So the best thing you can do is supervise them when they're eating. Okay, then if it happens, you're there, you can take action straight away, and there won't be any long-term implications for your child. So supervise your children when they're eating, and if it does occur, after today, you'll have the skills to know what to do. So obviously, this is just one topic that we cover in our first aid courses for parents that we run, both as public sessions and private sessions. So the first thing we're going to focus on in choking child, if what to do, is we need to first identify, is our child choking? Yes. If so, is it a partial obstruction to their airway, or is it a full obstruction to their airway? If it's only partial, it's great news for you because they'll be able to clear it out on their own without you hardly touching them, okay? And how you will identify that is they will be coughing, okay? Babies that are newborn, that are just born, they have born with their cough reflex. So even if day 1 of birth, they get a mouthful of their own saliva, mucus from the birthing situation that they've been through, then they'll be able to clear it quite easily with some coughing. If the coughing has not been successful, obviously you need to look at the position that your child's in, because it's really hard to cough out something when you're lying down flat. So just make sure if your child is choking a bit on a food or their own saliva, a bit of vomit, just sit them upright, cough, 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 and they'll clear it out. Now, a lot of parents stress out with their young babies that when they're in bed, they might be quite a refluxy baby, bringing up a little bit of vomit. The good news there is that, yes, it is a little bit more difficult in that position, but they do still do a good job, okay? They will change position, they'll move around, they'll cough, 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 and eventually they'll either vomit it out or swallow it down, okay? So if they're continuing to cough, you might need to just lift them up, give them a pat on their back gently and reassure them, and that's all you need to do. So there's no time to panic here. They just have a partial obstruction, they'll continue to cough, and pretty much every child will do that time and time again with a partial obstruction. All right, but what you want to know and what you're here to know is what to do if my child has a full obstruction of their airway. So what we need to do here, we're going to use a combination of back slaps and chest thrusts to get this object out. The aim of these two techniques is to create a quick force of air that's sitting in the lungs out through the mouth and the nose to propel the object outwards. Okay, so we do that through our back slaps, and we're going to do that through our chest thrusts as well. So for me, when this has happened at home with my youngest daughter, the last time she did this to me, I was changing her nappy at home. She had a big pooey nappy. It was a considerable amount of time spent trying to clean her up. I didn't notice that she'd taken out her hair clip and popped it into her mouth. All I knew was that she was choking when I heard that sound of choking. So that sound as she's trying to breathe but can't do it because she's got a blocked airway. So as I've looked down, I've seen the hair clip. And as a parent, what we like to do, we like to pick at our children a lot. If they've got something up their nose, in their ear, anywhere, we sort of pick it out. I want you to avoid that when your child is conscious and awake, looking at you, and they're choking, for two reasons. One is they are absolutely frightened here. They are so anxious. And you will know straight away when they've got a fully obstructed airway because their eyes pop out nice and wide, tears are streaming down their eyes, and they're like at you, okay? And it creates a lot of panic in you too. But avoid sticking your finger in because they're so frightened that sticking your finger in they may resist you, they might fight you against that, and you might end up pushing it down further, which is not great, okay? So avoid that. The other reason is they can bite off your finger. Okay, not pleasant for you either. So just avoid that because these other techniques work brilliantly. All right, so just with that, so I avoided picking out the hair clip because it's sitting right at the back of her throat. Just grabbed hold of her, popped her over my lap as I was standing there, and between her shoulder blades, just get your heel of your hand and you just give them a firm whack. Okay, now you can give up to 5 back slaps. It's like CPR. Does it matter if I give 6 or 7? No. I don't care how many you give. Just do them, okay? It's like CPR. Does it matter how many compressions I do? No, just do them, okay? So the back slaps work really well. So you give one firm back slap. You're supposed to then pause to see if it's come out. And, of course, how will you know if it's come out? You've just slapped your child. So what sort of reaction will you get? You'll get crying, okay? If they've got a clear airway, they'll start to cry soon after that, indicating they are breathing, okay? If it hasn't worked immediately, you're going to go on and do your second back slap. Number 3, if it hasn't cleared. Number 4, if it hasn't cleared. Number 5, if it hasn't cleared. But from parents who have done this and from my own experience, it works really, really well. So usually in the first 1 or 2, it's out. Okay. For me, I think it always cleared on number 1 or 2. I heard a drop to the ground of the hair clip, but she copped all 5 because in my head I just had 5 back slaps. So I just went bang, 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 bang. And she probably copped an extra couple, even though she didn't really need them. So no harm done there. In terms of how hard to hit them, it's a back slap. It's not a back punch or, cause major injury here. It's a slap that at best it would leave a slight red mark. But it needs to be firm and it needs to be fast, and you need to have the child either over your arm or over your leg as a firm surface, okay? So you should not get past this point because you've done a great job with those 5 back slaps, okay? If, however, thing's really lodged in there, there is the other technique, the chest thrust. But if you're moving towards this, start considering screaming out for someone to call for an ambulance or start making your way towards your own phone. But in this circumstance, it is very uncommon to get to this stage. In terms of chest thrust, it's slightly different amongst the age group. So under 1, you're going to use 2 fingers. Over 1, you're going to use the heel of the hand, okay? Because they're bigger, they can take more pressure, all right? So under 1, we're going to do 5 back slaps. 1, pause to check to see if it's clear. 2, 3, 4, 5. It's a sharp blow to the chest wall there, okay? In a similar spot to where you would do CPR, so just between the nipple line, centre of chest there. Now, of course, if that did not work, you are just continuing cycles, remembering that hopefully you've managed to call for an ambulance now, okay, and they're on their way, and you just continue those techniques there between the 5 back slaps, the 5 chest thrusts. Hopefully, though, it clears on the first couple and you don't have to stress out anymore, all right? Now, over 1, the back slaps are exactly the same. Okay, just over your lap. 1, 2, 3, 4, 5. If needed, obviously, not like me, you can stop after the 2 if that's when it clears. And then the chest thrusts are in the same spot, but 1, 2, 3, 4, 5. And hopefully, you'll be very successful in clearing that airway very, very quickly. Now, worst case scenario is you find your child is unconscious. You may have been out hanging the clothes on the line, making a cup of tea, went to the toilet, come back in, and maybe you haven't seen your child or had visual contact with them maybe for the last 7 or 8 minutes, because that's all it takes is for them to go unconscious from a choking episode. So you've come into the room and you've found your child on the ground, not moving, not responding in any way. And of course, that is the most terrifying situation for any parent. So you'd obviously pick them up. Wake up, baby, baby's not waking up. First thing I need you to do is have a look. Is there anything lodged inside their airway? So you can put them down, grab hold of their jaw and open it up and have a look inside. And of course, if you saw something in there, you need to get it out. The easiest way to do that in an unconscious child, flip them over. Gravity's going to help you. You can put in one finger and do a gentle finger sweep to try and dislodge that object. After that, you would then check to see if they're breathing. And if they're not breathing, you would commence CPR. If they were breathing, we simply leave them on their side until more help arrives. But what the point here is, that is when children do pass away from choking, often it is in the situation where the parent hasn't been around the child when it's occurred, come into the room, found them unconscious, and then frozen. You've got a child that isn't breathing, that isn't responding, they are in cardiac arrest, you call for 000 and they do nothing between now and when the ambulance gets there. That's of no help to your child. What you need to do is look inside their airway, clear it out if you need to, if you can see it, and then if they're not breathing still, commence CPR, okay? But those occasions are very few and far between. So I don't want to scare you all that this is going to happen, but most of the time, parents are there when it occurs. They do the back slaps, the chest thrusts, and it all ends up very well for the child. So as we move through, you can see the back slaps there in the infant under 1 and the chest thrust there for the infant under 1 as well. So in summary, if they have an effective cough, don't stress. Make sure they're sitting upright. If they need some assistance there to do so, and just encourage them to keep coughing and using reassuring tones with them. If they have no effective cough, the back slaps, then the chest thrust if needed, okay? And then obviously worst case scenario, very few and far between, but if they are unconscious, you would commence CPR if you cannot clear and establish breathing after that point in time. So for some of you already, I've handed out our choking magnet, so you can come and grab one of those. You can come and grab one of the choking check guides as well at the end of the session. If you've got any further questions, I'm happy to answer those now. And if you need any more information, our stand is just in aisle I there. You can come over. We've got a range of our first aid kits as well as our information on our courses as well. So does anyone have any questions about the topic today? Hopefully I've explained myself. Yeah, or feeling a bit more confident. If you want to come and have a play and hit this child instead of your own child, you can always come up and do that too, all right? But I'd like to thank everyone, and feel free to come up and grab that information as we finish today. So thanks everyone, and enjoy the expo. Enjoy your day. Thank you.